I'm Sophie Shephard. I'm a titled pain physiotherapist working on Wiradjuri country, Wagga Wagga. Urban normativity or metro normativity, depending on which term you use, it just describes this tendency that we have to kind of see metro as the default normal. So the city is the normal. It's always seen as very progressive and exciting and modern. And in contrast, there's this tendency to really see rural areas as a bit maybe less developed, maybe a bit backwards or outdated, and really viewing rural through a deficit lens. And we kind of see that in the way that people might sort of talk about issues with rural health. We often hear a very strong narrative about rural areas lacking workforce or having, less educated providers or less specialised services. So it just creates this really negative view of rural areas a lot of the time, quite unintentionally. And a lot of that is unconscious, but what that means is that when we go to do research or we're looking at developing policy, that these sort of subconscious attitudes might bleed through in the way that we view and do research, but also then influence policy decision making, and that then impacts on real world initiatives and outcomes as well. And the challenge with it is that that can then really reproduce the rural inequity, even though we're kind of trying to do the opposite a lot of the time. So it is really important that we view pain management research and policy through that rural lens as well, because we do know that from a lot of the things happening at a policy level, the National Strategic Action Plan, for example, rural areas have been identified as a priority area because we know that there are really unique challenges that exist in these areas, and that rural people do face a greater burden of pain and chronic health conditions. So we know that it's a problem, and the issue that we have is when we then have a lot of metro-based research being done and a lot of these sort of urban normative or very city-centric ways of looking at things, is that we often do miss rural voices, and we sort of assume that what we're doing in the city and the way that we think about pain management and all of our interventions are often tested and evaluated in the city. And we're kind of assuming that taking that and retrofitting it to rural areas is the way to go, and that's going to be effective. But it's important that we then step back and question, well, actually, is that what we need to be doing? Or do we need to consider whether this evidence-based model of practice that we've developed in the city, is that actually, the best way to do things? Or do we need to consider whether there could be other different models of care that are actually more fit for purpose in rural areas based on what people in these communities are telling us? Everyone has a role to play when we're looking at this issue. I think a big thing, regardless of your setting, whether you're working clinically, whether you're working in research, policy, doesn't matter whether you're a health professional or you're doing something else, I think just being mindful that there is this tendency to assume that metro is the norm. So actually pausing and challenging some of our assumptions that we might have, and actually just pausing to think critically and think, could there be a different way of doing this? If we know that there are challenges with implementing our current solutions or things seem not to be working, being open to being flexible and to maybe question some of the assumptions we've made in these things, and actually thinking about things differently. And I think importantly, being open to hearing the voices and actively seeking out the voices of people who do live and work rurally, whether that's clinicians or whether it's people living in the communities who have different health needs. So the challenges that people in rural areas face do vary quite a lot depending on the area where we're looking at. I think we've got to be really careful we're not just generalising, because every single town has a whole different set of circumstances and resources that might influence the different challenges in that setting. But generally speaking, rural areas do experience less workforce per capita, and so that can make it really hard when we consider our best practice model of pain care being the interdisciplinary team. It does mean that it's harder to implement that in rural settings because we don't have as many people that could form part of that interdisciplinary team. So workforce is certainly something that gets talked about a lot. But even thinking about some of these social determinants of health too. So we know there are a lot of access issues, less health services that are available in these areas, less infrastructure, but also at an individual level, people in these areas, while there may be some people who are much better off versus not, generally speaking, rural areas do experience socioeconomic disadvantage and educational disadvantage. So there are a lot of layers to the social determinants of health that might lead to challenges in this area and contribute to poor pain outcomes.